Good. All right, that was a bit loud. So, just to welcome us to this webinar series, to today's webinar, I'd like to start by apologizing. I think we had some bit of hitches, so that's why it's taken us a bit of time. I hope you can also hear me clearly. If I can just get someone to raise their hand for me to know that I'm audible enough, and then we can start. Okay, thank you, thank you. So Dr. Karanja will be joining us shortly. She's in a bit of a bind at the moment. My name is Naomi. Let me put up my video. Okay, the host has stopped video, so I don't know if you can unstop that for a moment.
Yes, can we just attempt again?
Okay. So camera allow. Okay. The lighting may not be good. But this is now angle. Okay, so we'll just make do, but whoever appears on the photo is me. So my name is Naomi Anyango. I work in the Ministry of Health at NASCOP, Division for National Deals with HIV. So I'm happy to be here on this webinar just to share what we have as regards to suicide, and my talking points today will be on suicide, suicide risk factors, the warning signs, and what someone can do when they find that they are suicidal, because that's a question that more often than not we find we don't talk much about it yet. There could be someone around who could be going through something. So thank you. And I think I'll just begin right away. I'll share my screen. Yes, continue. You can see my screen? There we go. So today's webinar is about suicide. But before we talk about suicide, there's what we call self-harming behavior. And there's a difference between self-harming behavior and suicide. And this is because self-harming behavior, usually there is no intention for death to occur. And when that is the case, then we cannot even say that a person is suicidal. And most of the times when people engage in self-harming behavior, it is because they're trying to communicate some sort of distress that they're experiencing. They're trying to cope with situations that they are going through, and that is why they engage in self-harming behavior. Suicide, on the other hand, is death that is caused intentionally by injuring oneself. So here there is the intention to end one's life. Then we also have what we call suicidal attempt, whereby intentionally one injures themselves, but they're not successful and they don't end up dying. So that is what we call suicide attempt. So just some key facts is that more than 700,000 persons die due to suicide every year, and this is translated to about in 40 seconds, I think we lose about 4 people. And the other thing about suicide is that for every attempt that it is successful, there are 20 other attempts that have not been successful, meaning that there are many more people who attempt suicide as compared to the ones that are actually reported. And one of the risk factors for another suicide attempt is a prior one. In 15 to 29-year-olds, it has been found that it's the fourth leading cause of death, which means that the number of persons who die as a result of, for example, malaria or breast cancer, this overtakes them. And that 77% of global suicides occur in low and middle income countries, mostly concentrated in Africa. And when you look at that percentage, it really says a lot. And that means that there's a lot more that we can do to be able to reduce this percentage. And the most common methods include ingestion of pesticides, hanging, and firearms. So when we talk about risk factors, it is those situations that people experience that predispose them or make them more vulnerable to end up attempting to end their lives. And these risk factors can be categorized as individual factors, at relationship factors within the community, and also at society level, what we call as societal factors. So when we talk about individual factors, what can contribute to one thinking of ending their lives can include a previous suicide attempt, as has been mentioned earlier, then a history of depression or any other mental condition. And this is because most of the times when people suffer from mental conditions, due to the distress that it comes with it, it can make them think or predispose them to want to end their lives. Serious illnesses such as chronic pain, amongst others. Then when it comes to relationship, this is about hurtful or harmful experiences within which a person experiences in a relationship. This can include bullying in schools, be it primary or secondary or even universities. This can include intimate partner, the bullying that the bullying that persons might experience in romantic relationships, intimate partner relationships, at relationship level also, some comments that may come from the parents trying to compare children with others or just within that relationship. So aside from that, then we also have community factors, and one of the things to do with community factors is the stigma that is associated, for example, with mental health conditions, or even we've seen this a lot also in key population, because the stigma that they experience can make them feel like they are unwanted or not usually or not needful in society, and it can push them into getting conditions like depression, and they may become suicidal. Aside from that, we also have societal levels whereby if we don't have means of access to treatment, and this has a lot to do with government policies and the kinds of services that are offered, if they are not at par, or if they're not able to respond to persons who are experiencing suicidal thoughts, then this can push them into wanting to end their lives. So this photo is not very clear, but it just tries to highlight some of the risk factors for suicide that are there, which include history of substance abuse, previous suicidal attempts, as mentioned earlier, death of a family member or of a close friend, and others. So when we have risk factors, we also have protective factors, the things that exist in the environment that would prevent or buffer a person from wanting to end their lives. And one of this is closeness. Closeness with families, at work, in the school, and know that if we have a problem, then there's someone you can always reach out to and talk to them, and they can be able to help you with whatever challenges you're going through. Then it becomes easier for someone with a problem. Also, school safety, and in school is where we experience a lot of bullying. So when schools are able to put up policies that prevent others from, or the students or the learners from experiencing bullying, then it becomes a protective factor for them. Parent connectedness, I'd given an example earlier whereby parents push the children by comparing them with others and making them feel like they're not worth it. But if the parents are able to be at a level that they understand their children, they can see through their troubles and be able to comfort them and get them help when they need it, then it becomes easy for that child to be able to resolve whatever symptoms they have that could have probably pushed them into suicidal behavior. Academic achievement, and when people perform, they are happy, or when they get what makes them happy in terms of their achieved academics, then they're happy, and it protects them from thinking of taking their lives, as well as access. And access is about provision of services, and not just provision that you come, you have a problem, we see you, but in a way that is non-judgmental, in a way that is compassionate and empathetic, and makes the person feel accepted and given services that adequately respond to the feelings they could be experiencing. So that would mean getting them psychiatric help, getting psychotherapists, referring them to other services that they may need, be it legal, be it spiritual, be it academic, and so on, as well as neighborhood safety. When we find that among the social determinants of health is the built environment, which includes the neighborhood, is when there is a buffer that protects persons in these neighborhoods to make them feel that in as much as probably there are problems, but they can be able to overcome them, then it becomes a protective factor, not pushing them into wanting to end their lives. So as we have persons in the community or in our settings who could be suicidal, there is a way that we can know they're thinking of ending their lives. And one of these ways is when they start talking about it. More often than not, we've had situations whereby when someone ended their life, people will say there are some cryptic messages, for example, they posted on social media, or they had been making comments. It's a subtle way of trying to express what their intentions are. And this also includes looking for a way to end their lives. As mentioned earlier, they're the one that persons are looking for these ways, then it's for us to be cautioned that there could be something they're thinking of. Some will talk and say that I'm tired of this life, I want to end it, and so on and so forth. And something that is also very keen to watch is giving away prized possessions. And more often you'll find this happens when someone has been depressed for a very long time, and all of a sudden they come out of this depression, or they come out of this negative emotional state that they had been in, and they're now very happy. They are giving away their prized possessions, which would not have been something that I've considered earlier. Then it is a warning sign. It tells us that we need to be very cautious and follow that person and find out what could be happening with them. When we put them in a box and they say they're feeling trapped, or they feel they're not amounting to anything, no matter what efforts they try to make, or them saying that they feel as being a burden, then it's a caution, it's a warning sign that you would need to. It's a warning sign that we would need to get from them what is going on. Sleeping and sleeping is one of the symptoms that is usually looked at or considered when persons experience some sort of mental distress, where you find them saying that they're either not sleeping well or they're sleeping too much. Aside from that is that feeling of being withdrawn or isolated, whereby someone used to participate in activities before, and activities can be as something as small as going out to lunch with friends, or watching a movie with the family, or just engaging in some hobby. And we find that they are not able to do that anymore. So it also becomes a point of caution that we need to look out for. Showing rage, and this can happen in persons who are, I hope I'm audible. Nelson? Nelson, if you can hear me. Okay. So if I'm audible, someone please raise their hand. I've received a message that can't hear me. Okay, so okay. Thank you. Overwhelming responses. All right. I don't want to be in this one. All right. So I think there could be a problem because I'm told that the slides are not moving. So I'm in the know the signs slide. I hope we'll get there. But even if we don't, just follow what I'm saying. So I was mentioning about withdrawal or feeling isolated. And that's why we are reminded to be our brother's keeper. That when you find there's a family member or there's a friend or a colleague who suddenly, and sometimes it's not suddenly, it could be you notice this after a while, that they are not socializing the way they used to before, then it will be good for us to be able to find out what the problem is. Is it that they don't like the company anymore, or is it that there could be some things they're experiencing in their life and that's why they're isolating themselves? Then also, some signs include displaying extreme mood swings. One moment someone is happy, the next, without any warning, they are very sad, or they are very irritable, or they're just full of rage. And we can be able to tell this based on the day-to-day interactions that we have with this persons, as well as the increase in the problem, and we need to find out, solve them. And again, and behaving in a way that I've been experiencing is now gone. So I hope you can see the screen that is showing a pictorial on some of the suicide warning signs. And one of them is just talk, basically what I've mentioned earlier, whereby experience mood, you recognize some anxiety, some behavior, then a person becomes aggressive, visiting or calling people to say goodbye, including withdrawing from activities. So, what are the things that we can do to be able to prevent persons from ending their lives? The WHO approach is such that and live life is about limiting access to means of suicide. That means that countries are able to put down laws, regulations, sure access to means of suicide. Mentioned about the most common methods regulate. This is just an example. That then interacting, stands for interacting with the media for responsible reading. Many a times we find that when we read about whether it's celebrities or an unknown person who ended their lives in the media, we are given a full picture of what this person could have gone through and the process it took. And by that I mean that there's comments on what people saw before, and then now that they've ended their lives, we are given a full picture in terms of the method, in terms of the activities they had carried out to be able to get to where they are rather. And this becomes a means for other people who are contemplating to get ideas and want to follow the same. So when it comes to media reporting, then it needs to be responsible, whereby we also, in as much as we are talking to those who are contemplating and directing them to places that they can go to be able to get help and not go through with these plans that they could be having. The F is for fostering socio-emotional life skills in adolescents. And this can be applied mostly in schools. Remember that the statistics tell us that 15 to 20 teach them on being resilient, because life, there's a lot, have some form of resilience where we can deal with what comes our way. Last but not least is early identification, assessment, management, and for people who are affected. And early identification, as healthcare workers, we are able to screen those who we consider at risk. And as we screen and assess them, we are able to management, whether admission or follow-up in the community. and then also just checking in on them to where are they now. Are they receiving some psychiatric? Are they receiving some therapeutic psychotherapy? Has pushed them. So what WHO reminds us is that then we need to carry out a situation analysis just to find out in our communities or in our countries what are the numbers telling us, so that we know the severity of the problem, what actions we need to take to as soon as possible. Meaning that governments cannot work alone. They need partners to come on board to help them reach each and every person in the community and be able to give them skills on how they can cope with life's challenges, gatekeepers. And for this, need to finance this, and not just governments, but also the stakeholders that they're working with would need to set aside some finances to be able to do this work. And even as they do that, then they'll need to constantly survey and find out, based on the situation analysis that has been carried out prior, how is the going? Is it improving? Is it not doing any better, or is it getting out of hand? And this basically goes into, yes?
Naomi, this is Dr. Karanja. Kindly, your slides are not moving. So if you could kindly try and see how you could reset. There's a lot of concern from the audience.
Okay. So yeah. I think maybe that's an internet issue.
You're also breaking quite a bit. I don't know whether I don't know. Are you able to adjust your internet also? We cannot hear you continuously.
Sorry?
We are also, you're breaking as you speak, so your sentences are most of the times incomplete. Is there something, do you want to check your network before you proceed?
Yeah, I'm just doing that.
Thank you all for your patience. All right, now try and put in slideshow mode. We apologize for that. Naomi, you can try and share again and put on slideshow so that it's occupying the screen.
Which screen are you seeing?
We are now, you're no longer sharing.
Okay. Can you see my screen now?
Yes, now just click slideshow.
So you can see suicide prevention strategies.
We are seeing, yes, that is what we are seeing.
Okay.
All right.
So I don't know if I need to go back, if there was some breaks, or I just continue.
Yeah, there was quite some breaks. We could hardly hear you, but now you're more clear. So if you could maybe go 2 slides back, that would be appreciated. We have some time still left. Thank you.
Okay. So risk factors, was this clear?
Yeah, but what I'm saying is, could you put it in slideshow, because as it is not possible to see nicely.
Yeah, I want to confirm if this was clear first, then I know where I need to start, and then I'll put it in slideshow. So
we can
was
start
this?
there. We can start
Start
there.
here.
Yes, thank you.
Okay. So apologies for that. Internet sometimes can be I don't want to say some words, but yes. So just some risk factors for suicide can include physical disability or chronic illness, and chronic illness can also include chronic pain. A history of substance abuse can put one at risk of attempting suicide. And the number one risk factor for suicide is a previous suicide attempt. Then others include relationship problems, romantic relationship problems, parental relationship problems, as well as access to harmful means. And when it comes to access, then one of the recommendations is that to prevent suicide is to be able to check on that. Then also death of a family member, a close family member, a recent death perhaps, or that of a close friend. A mental health condition such as depression or schizophrenia or bipolar can put, amongst other mental health conditions, can put one at risk for suicide. I hope I am very audible and clearer now.
Yes, you are.
Okay.
Carry on.
Exposure to bullying, and we've seen this. Remember that the statistics tell us that it is the fourth leading cause of death among 15 to 29-year-olds is suicide, and this is why bullying is considered as a risk factor. So as much as we have risk factors, then we also have protective factors, and that can include parent connectedness. Remember, we talked about relationship issues. So when children feel connected to their parents in a way that they can express their emotions and the challenges they're experiencing in an environment that is safe, that they feel wanted, then this is what we mean by parent connectedness. Neighborhood safety, we know that in any environment or in any location where people live, neighborhoods are different, and there are those that could be experiencing more issues than others as a result of their economic stability, and can predispose them to a risk for suicide. So if there's this neighborhood safety in terms of even security, it's a buffer. Overall resilience, we are different, each of us. We all have different coping mechanisms. There are those of us, when we experience, even if it's a traumatic event, within maybe 2 weeks, 2 months, we are okay. But there are others who reliving such experiences can predispose them further to want to become suicidal. Connectedness in terms of having close friendships, close family relations.
You're still on the risk factor slide. Kindly move the slides.
Okay, I think then it's an internet issue because I'm on the protective factors slide from where I am.
Okay,
So
because just carry on then speaking. It's okay then. We kindly, those who are attending, we beg you to bear with us because of the technical hitch, and we just listen to Naomi. She will attempt to move the slides. If it's not moving, just listen to her. Thank you, Naomi. You may continue.
Okay. So I've mentioned on protective factors, and for us to be able to prevent suicide from happening as healthcare workers, as people that live in communities, then we need to be aware of the signs that we can look out for to know whether someone is attempting or thinking of or planning to end their lives. And one of them would be to look out for persons who talk about wanting to die or kill themselves. So when we hear such comments, then we need to ask ourselves, how else can I help this person? You need to find out what could be the reason as to why they're making these comments. And I remember recently there's something that happened in Mombasa, and I was just being reminded today in the morning that this person had been saying that, and even at the time when they set themselves ablaze, they mentioned, I'm going to end my life. So we need to be wary of such comments and look out for our brothers and sisters. Then persons who look for a way to kill themselves, we also need to be aware of such, including when one all of a sudden comes out from being hopeless or helpless and they were very sad, now they're very happy, and in the process of this newfound happiness, they're even giving away their most prized possessions, which in other circumstances would not have happened. Then we need to be keen. We need to find out what could be driving them to behave in that manner and just determine, could there be something deeper? Is it someone who's contemplating ending their lives? And if so, what is it that we can do to help them? Some people will talk about feeling trapped or being in unbearable pain, and the only way to get out of that is if they end their lives. Some will withdraw, or they'll become more and more isolated. And again, a reason as to why we need to watch out and be our brothers and sisters keepers, and just try and check in with them and find out, if you determine that someone who was once socializing very well is not available anymore, then we need to check in and find out if there's a problem. And if indeed there is a problem, how would you be able to help them? And that also includes an increase in the use of alcohol and drugs in a person. So as we look at the signs, I don't know, you can see my slide that says suicide warning signs.
Unfortunately, we are still stuck on risk factors, Naomi.
Wow.
We are not able to see anything beyond risk factor. It kind of froze at that, but perhaps you can describe to us.
Okay, so this was just a pictorial on what I've mentioned below, that in terms of talk, persons will say they're experiencing unbearable pain, they feel they're being a burden, or they have no reason to live. Then in terms of their mood, you may notice that there's a loss of interest in things that they used to enjoy before. They've become more irritable. They're exhibiting a lot of rage and anxiety, amongst others. And in terms of their behavior, you'll find the person withdrawing from activities, acting recklessly, sleeping too much or too little, becoming aggressive, and increased use of alcohol. So this was just a pictorial on the suicide warning signs. So for us to be able to deal with the problem, we have what we call the Live Life approach. And this Live Life approach is an acronym whereby L stands for limiting access to means of suicide. And this can be supported by putting in place policies and guidelines that ensure it's not easy for persons to get these tools that they may use to end their lives. Then interacting with the media for responsible reporting, whereby it's not made sensational when, especially in the case of a celebrity, and then everyone talks about it and they want to give every little small detail of what the person did in the process of ending their lives. And also to encourage the media in terms of responsibility to give hope by giving options where people can be able to seek help, so that if one is watching a story or reading a story on someone who has ended their lives, then they can get information on where they can get help if they could be experiencing the same symptoms. AFIS for fostering socio-emotional life skills in adolescents, whereby in schools they are given or they are taught life skills on how to deal with the challenges that we may experience in life. We all know that life is not a smooth road. It has its bumps and its potholes, and we need to be resilient. We need to develop coping mechanisms that we can use when we are faced with a challenge. And last but not least is on early identification of persons who are suicidal, being able to assess them, to manage them and follow them up, just to ensure that whatever emotions they were experiencing that led them to the point of becoming suicidal, they are able to resolve them so that they can continue to enjoy their lives. And for these prevention strategies to work, then they need to be followed by or accompanied by a situational analysis where we find out in our communities or in our societies, where do we stand in terms of the numbers? Are we getting many people attempting suicide? And what could be the reasons? So trying to find out also strategies to be able to deal with this. And for us to be able to achieve that, then we need to collaborate with every other sector within where we are. So we have a multi-sectoral collaboration. We need to create awareness like what we are doing today and in this coming month of September. Let people know that yes, suicide or self-harming behavior does exist and there is help for it, and one can get better and be able to live a fulfilling life. Capacity building, whereby healthcare workers or even gatekeepers in the society are just brought up to speed on how they can be able to help in identification and dealing with these cases of persons who are suicidal. And for this to happen, there also needs to be some financing. And aside from that, then we also need to have some form of surveillance whereby we check. When we started, we were at this point. Where are we in terms of monitoring and evaluation? And are there areas where pockets in the community where it is more prevalent than others, and be able to determine what could be the causes there? And the beauty is that in Kenya, we've managed to develop a suicide prevention strategy for the years 2021 to 2026, which outlines steps or strategies that can be employed by various sectors in our communities to be able to deal with or to be able to prevent suicide. So are you able to see the next screen, which says what to do when? Or we are still stuck?
Yet. Maybe perhaps you exit the slides, you close them, then open again and see whether you can share afresh.
Okay, I have
It
done
might
that.
actually,
Yes.
yes.
And then, because I think it's important. There. Are you able to see this screen?
Yes.
Okay. So as we talk about suicide, then it's also important to talk about what do we do when someone is suicidal. And there are different levels as to what you can see on the screen. So there is no thoughts whereby no one or a person hasn't thought of ending their lives, and or even a loved one hasn't thought of that. And if this is the case, then if they have other issues that they're dealing with, then they can attend individual therapy to be able to sort those issues. However, when they start to have passive thoughts like maybe I'd be better off dead, then we need to pause and take a moment and just be able to help this person. And if you are that person in this webinar today, then you would need to seek therapy to help you deal with whatever emotions that you could be going through, because there is help and there's treatment. Then there are those persons who have had these thoughts of ending their lives, but they haven't had a plan. They haven't thought of, if I was to do this, I will need to do 1, 2, 3, and they're not actively thinking about how to carry out this plan. Nonetheless, it's good to have a safety plan, because again, remember that persons who've attempted suicide once can attempt it a second time, a third time, and so on. So if one has these thoughts but no plan, then it's good to have a safety plan and have a person that you can call when you're in crisis. This person can be a loved one, or just be aware of a health facility near you that you can walk into and be able to get assistance so as to be able to resolve the issues that you could be going through. So if one has made a specific suicide plan, they have a plan to act, they've just considered acting on it, then I will share in the next slide some numbers that you can call. And when you call these numbers, you'll be able to get some help, and you will be guided whether the next phase we would be walking into a health facility, the type of help that you can get, and how you can be able to just get assistance with these thoughts that are there. And if you are in active preparation, either you or a loved one, and you're exhibiting the signs mentioned earlier, such as giving away possessions, or you've already written a suicide note or thinking of what to put in one, then one of the things that we can do, if it's a loved one who's doing this, is we need to remove means that they can use. But aside from that, we would need to reach out to some health facility where they can be able to get further assessment, and be determined what type of management will be used for them. So I will stop sharing again and share a screen that has the numbers that we can make use of. So share screen. You can see my screen that has suicides helplines. Hello, are you able to see my screen?
Yes, Naomi, go ahead. We can see it.
Yes, so we have 1199. This is from Red Cross, and it does work. 21094, we've mentioned people who are experiencing some traumatic experiences, could be suicidal, such as GBV. So 21094, you can send a message and they'll be able to get you help. Then if you feel
we are losing your audio, please repeat that again. Naomi is trying to read the numbers. We can't hear you. You're breaking.
You can call for NACADA. Then we have 1199, 911, and they call these numbers at times and get that they're busy or they are engaged. Are you able to see my screen?
Yes, your screen is visible, though your voice is breaking.
Okay. So I just mentioned that these numbers you see on your screen are very much active. We can pick them and make use of them and share them out as well. And in an instance where you call, apart from 21094, where you can only text, in an instance where you call this number and it doesn't, it's engaged, do not give up. You will always get a response if you hang on or hang in the line. I don't know if that English is correct, but I know sometimes people will see 911 or 112, the Kenya police number, and they'll be very adamant to want to try, but there's no harm in trying. So I think I've come to the end of my presentation. Perhaps we'll take some questions from here.
Thank you, Naomi, for that presentation, despite the few technical hitches here and there.
Sorry for that.
It's all right. We are living in a digital era and we have to learn to adjust even the hiccups that come from time to time. They should be expected, and the audience is clapping for you for the presentation. So you did a good job. Yes, I am Dr. Mercy Karanja. I joined a little bit late. I'm moderating the session. I'm a psychiatrist working with the Division of Mental Health. And I want to get a few questions I can so far only see one question in the chat from Mary Wanjiko, and there are a few people whose hands are up. Maybe I'll start with the question in the chat as I ask the people who have raised their hands that I'll give them an opportunity to speak. So Mary Wanjiko is asking, could Naomi elaborate the point she mentioned about WHO supporting the low and middle income countries to ending the increasing suicide rates to 77%? That is one of the questions. Maybe you can answer that as I ask, and Eric Mwalimu's hand has been up for a while. You'll go next as soon as Naomi answers that.
Yeah, and I want to answer this by putting up a slide that says the WHO approach of Live Life. I hope you can see the slide. Suicide prevention strategies.
Yes.
Yes. So the WHO approach, which is Live Life, if we are able to do the 4 things that we can see on our screens, which is limiting access, interacting with the media, fostering social, emotional life skills, and early identification, then we will be able to reduce our percentages in terms of completed suicides, because 77% of suicides are from low and middle income countries. But if these low and middle income countries are able to adopt these 4 approaches, and when they adopt this, it would mean that they are able to develop a suicide prevention strategy, then it means in future when they do a report, 77% will come down to probably another different percentage, maybe 40 or 10 or 5. And for us to be able to do that, yes.
All right, Mary, I hope your question was answered. I want to, Eric Mwalimu, I will unmute. You've disappeared. His hand was up. There's a question. You kindly comment on suicidal thoughts. And then the second question is, what do psychiatry want? That one, I think it's somebody who wants to do psychiatry. How to contact you for advice. There's another long from Dorothy Mbaliza. Thank you for the presentation. Working in the medical ward in Kitale County Referral, and we never lack patients with organophosphate poisoning, and the common cause is due to failed relationships, finances, and school performance. Maybe you can comment on suicidal thoughts, then I'll give 2 or so persons a chance to ask the questions, the ones whose hands are still up.
So suicidal thoughts are basically just thoughts to end one's lives. And they can be verbalized. And I think most of the times, eventually they are verbalized and someone says, I'm tired of this life. I feel like I'm a burden and I would be better off dead. So these are thoughts that one would, they are intrusive and they keep coming again and again. But the common theme is wanting to end one's life. So for one to be able to cope with these suicidal thoughts, then the advice is to seek help. Seek help by going to the nearest health facility or calling the numbers that I shared earlier, especially the 1199 Red Cross number, where you can be able to get more advice, or walking into a government health facility, outpatient, being seen and being helped to be able to cope with whatever it is that you could be going through.
Thank you, Naomi. Another question is there a role of imperialism and colonization in the increased prevalence of mental health disorders in Africa? That's a question from Mary Wanjiko. And from Ruben Marienga, how soon do the supporting team respond to the how soon do the supporting team respond to the incidents, and do they need any payment? Maybe Ruben, you can clarify on your question. It's not very clear, but maybe the one on imperialism and colonization and the role, whether it has a role on prevalence of mental health disorder in Africa. And how do you approach a mother who has lost a child and thinks ending her life will be the way to ease her pain? Naomi, as there are two more questions, maybe we'll respond to that I'm seeing. You can respond to those two first.
So I'll start with the last one. How do you help a mother how do you approach a mother who has lost her child and feels that ending their life will end their pain? So what comes out of that is that for people who are suicidal, there is always something that makes them feel that way. So in this case, it's that pain of losing a child, and it is normal to feel pain. So to approach this mother would just be to bring to their awareness that yes, it is normal to go through these feelings or this experience that you're having, and there's also help, and then pointing them to the place where they can get this help. And then the other question on imperialism or colonialism effect on Africans and pushing them into becoming suicidal, I feel that's a controversial one, because there's some who will say yes, that is why someone wants to end their life, but then there's some who say that, you know, they left a long time ago, and you know, it's not a direct reason as to why someone wants to end their life. The bottom line, I would say, is that when someone expresses their feelings and says that I am suicidal, then we just need to get them help, whether it's as a result of this colonialism, thinking or anything else, but just the moment they voice and they say that I am thinking of ending my life, then we get them help. They see psychiatrists, they see psychologists, they see social workers and other people in the healthcare team to help them be able to resolve the feelings that they have that are pushing them into having these suicidal thoughts.
Thank you, Naomi. Maybe I can add on to that because the question was on the role of imperialism and colonization in the increased prevalence of mental health disorders in Africa. We know that there isn't a single cause of mental illness and mental disorders or mental health problems. The causative factors are multiple, and they interact in different ways. They range from environmental factor, genetic factors, social factors, psychological factors. So there's an interplay of all those factors. So it cannot just be one factor that is causing people to have mental health disorders. So for an individual, it needs to be assessed further to know what is the real cause. And yes, and even in a society, the social determinant of mental health also vary in various settings. There was a question on how soon do the supporting team respond, and I believe Naomi already said that most of those lines are toll-free, and there is immediate calls to answer to a person in distress. Then there is a question here that I think you need to, although you've already alluded to it, these two questions may be related. Can we know the difference between acting out and a real suicide attempt? And secondly, if one attempts suicide once, what is the possibility that he can have another attempt again? And the final question is, can lack of motivation be a factor leading to suicidal thoughts? Maybe you can start with the difference between acting out and real suicidal attempt.
Okay. So I don't know what acting out means, but I'll try with I'll try to respond as to what I think the person could be asking. Acting out in the sense of maybe threatening that, just trying to get attention. I'm thinking that's it. So if someone is trying to get attention and using these words and saying that I'll kill myself, then I would say it's a cause for, it calls for us to listen. What could be making them say these words? There could be something underlying. Then once we determine what is underlying, then we get them the help that they need. Because remember when I started, I mentioned that we have self-harming behavior that doesn't necessarily, if there's no suicidal intent, then it's just self-harming behavior. But still, the self-harming behavior is as a result of some distress that the person is experiencing, and they are communicating they need help. So if that is what acting out means, then yes, they are communicating that they need help, and it will be good to get them that help through what we've shared in this webinar, so that they can be able to resolve whatever emotional feelings or distressful distress that they are experiencing. Then what was the other question?
Also, in addition to that, let us note that anybody who expresses the desire to end their lives, we should always take it seriously. Let's not assume it's attention seeking or acting out. So the second question that was almost related was, if one attempts suicide once, what is the possibility that he can have another attempt?
One of the risk factors for attempting suicide is a previous suicide attempt. So basically what it tells us is that for persons who've attempted before, then whenever they have, when someone attempts and they get the help that they need, the psychiatric help that they need, and they're able to resolve, it means that we still need to be aware of the way they relate with us and the world in general, and be able to pick any information from within them that maybe they are going through a stressor, because it can easily push them back into wanting to attempt suicide again. So yes, for people who've attempted suicide before, they can attempt again and again and again.
Okay, so the other question is, can lack of motivation be a factor leading to suicidal thoughts?
Again, I would talk in terms of duration. And by duration, I mean for how long has this person been feeling that they are not motivated, and not motivated in which way in their lives? Because maybe I'm just not motivated to follow up on a task that I've been given. But there are those who are not motivated with wanting to leave. Anything they do, they feel like it won't amount to anything, or other people do not see them, or whatever they do, it's not considered as meaningful. So if that is what lack of motivation would lead them to, then yes, they can have suicidal thoughts. But what we always need to remember is that once we are able to spot this in people, keeping in mind duration, I could be not feeling motivated today, but tomorrow I can be able to get back on track. Lack of motivation, I think it happens to all of us, because there are days you feel like you don't want to do things the way you would. But the severity of that, how frequent is that? How often has this been happening to you? Then that is where now we would start to ask ourselves questions. Is there something more going on with this person?
Right. Maybe this one is I feel you need to answer this one, but let me also add that maybe one of the commonest signs of depression is usually somebody feeling hopeless and helpless. So hopelessness can be a motivation of a sign of lack of motivation, and it's a very high risk for suicidal behavior. So we need to look out for such persons and reach out to them. So Kefa Manduku asks, and I thought this is important to answer live, is because he talks about alcohol use and the relationship to suicidal behavior. Maybe you can comment on that.
Alcohol use and suicidal behavior.
Yes, I've lost the question, but yes.
Yeah, so when one is an alcoholic, and by alcoholic I mean that there are things they are not able to accomplish in their lives, and they keep having losses, and alcohol is the cause of all this, but they still continue using it. When one is an alcoholic, it can get to a point where they feel suicidal because they've reached let me call it a bottomless pit. That's the feeling, and they would feel like there was no going back. There's nothing that they can do to remedy their situation, and also because most often you find that relationships that they've had with their spouses or their families or their workmates are strained, such that the other people feel like they don't want to have them in their lives. So it can push one into being suicidal once they notice that, or once they feel that they are experiencing a lot of pain as a result of being pushed away by society, or as a result of isolating themselves from the society. They feel like there's nothing they have to contribute, be it at home, be it at work, and they just feel like life has no meaning for them. Then they can feel or become suicidal.
Thank you, Naomi. I think it's also important to know that substance misuse, alcohol and substance misuse is a risk factor for suicidal behavior. Alcohol itself is a depressant. We need to make sure we look out for people who are using alcohol and drugs excessively. It can also cause persons to have impulsive behavior. This impulsive behavior can also include suicide. So alcohol itself, alcohol misuse, abuse, whether you're dependent or abusing, can be a high risk factor for suicidal behavior. There's a concern that has been raised, and I don't want us to let this one pass, about Dr. Silas Ayunga has talked about that we seem not to handle fellow medics well when they fall victim of suicidal behavior, and a number of college level and unemployed graduates are ending their lives. Are there any mitigation measures for both categories? I think this is a critical question to answer, since that most of the audience is medics. What is your take, Naomi, on how we handle fellow medics when they fall victim of suicidal behavior? We'll answer 2 more questions, and then how we can bridge the gap for the students and unemployed graduates.
I think that's a very timely question or comment to come in, because sometimes it's said that healthcare workers, they take care of others and forget to take care of themselves. And the reality is they're also human beings, and they also experience stressors or challenges in their lives that can make them become suicidal. So one of the ways I've seen the ministry respond to that is we have a suicide prevention strategy that outlines 5 strategic activities that can be that can be done so as to be able to respond to not just the medics but everyone else, but also taking a special consideration of medics, and this by increasing awareness. I thank the doctors or the medics that have joined this webinar, because now that you've been aware, for example, if you didn't know the numbers, now you know. Aside from this awareness is how to address stigma, and how to put in place strategies that will address prevention of suicide. So that's how I'd respond to that question. So the next thing would be to implement this, and that's why when you look at the WHO approach, it talks about a multi-sectoral collaboration, whereby medics will be able to come together uh, and be able to, I don't know how it will be done, because of course different areas will have different ways of doing it, but at the end of the day, awareness will be created, there will be capacity built, and they will be alerted to places where they can be able to get help. So I hope that answers, Dr. Karanja.
Yeah, Naomi, and additionally, let us also remember that healthcare workers are also human beings, and they face the same similar challenges that the rest of the society faces, not to add on to the severe, sometimes stresses they face when they're dealing with people who are sick. So they may need special focus when you're addressing their psychological needs. There's an interesting question here, and these ones are, I think maybe they may be related. One is that the community have related, some community have related suicide with the devil's work. How can this be mentally reduced? And that there's an attitude in the society that whoever wants to die should just die.
True.
So how do we handle that? So those two.
Yeah, it's very true. I think in the African context, whenever we are faced with issues we are afraid of and we don't want to address, we'll always attribute them to the devil. It's very easy to push it to the devil, and that's okay. But in as much as we do that, we are saying that we want to create awareness to let people know that it's not just the devil, but there are things people can experience that can push them into becoming suicidal. And once this knowledge is created, once this awareness is made, then it will bring more and more people to come to facilities to seek help. And I think there was a comment that had been made on the increase of, I think, mental health problems in Africa as a result of colonialism, something like that. So sometimes this increase is because people are now coming out and talking about it, and then we see the numbers are going up. But it could be as a result of they're now aware, they can identify some of the signs and the symptoms, so they now actively seek out help, and that's why the numbers are going up. So what we really need to do is create awareness and let people know that, yes, we have the devil who does his bad work, but we also have illnesses that can exist that can make people become suicidal. So we have a big job of creating awareness. Back to you, Doc.
Indeed, Naomi, I agree with you. And also, let us also remember that sometimes the cultural beliefs that we hold act as, they worsen the stigma and the discrimination around persons with suicidal behavior and mental illness in general. And these cultural beliefs and practices, some that are practiced even when somebody has already died by suicide, really create barriers to accessing treatment and help. So if we do demystify the suicide in our communities and delink from some of these cultural beliefs, we can actually support people and create and remove barriers to people accessing help. The final perhaps question I would like you to address is, where has it disappeared to? Yeah, two questions. One is, it alludes to the recent political demonstrations that were going on, the recent political demonstrations and audacity of some Protestants saying they were ready to die point to a tip of an iceberg. It seems suicidal to me. Are there solid measures by the government to mitigate against this? And the second one that is kind of related is indulging in reckless sexual behavior and being careless sexually a sign of suicidal behavior? So what is your response to those two questions?
Warning signs for suicide can include reckless behavior. So if you find a person, that's just one of the warning signs, but it could also be reckless behavior could also be a warning sign for something else. So how we are able to determine that a particular reckless behavior by a particular individual is pushing them to suicide is by asking and finding out what could be pushing them into behaving in such a manner. Then with regards to the politics, we've read that when the task force went around the country checking to see the mental health of Kenyans, is that there's a high burden of mental illness among Kenyans. And this can push people to behave in particular ways. And one of them would be to become suicidal by making some certain utterances. And that is why we need to create awareness and make people know that when it comes to suicide, these are the warning signs, and this is how you can get help. And once they're being given help, they're also followed up to see how well they are doing and if they are able to resolve the distress that they had that pushed them initially into being suicidal.
Thank you, Naomi. Unfortunately, due to time, the ones who've raised their hands, we are not able, there are so many hands raised. I wish you could have typed your question in the chat because we may not be able to answer. There are so many questions in the Q&A, and time is running out. There is a question here, what's the duration for someone planning suicide? Naomi, I think that is a critical question because I know it ranges from impulsive to very long time. Maybe you can comment on that. What is the duration for someone planning suicide?
Duration for?
Someone planning suicide. I believe the question is planning to actual attempting or completing suicide. What is usually the duration?
I think this is relative and it will depend on the person. There's a person who can decide, perhaps in the spur of a moment. Of course, they've been experiencing some sort of distress for a period of time, and then they decide, I'll end my life today, and they actually do something. And then there's someone who's been going through distress, and then they decide, I want to end my life. But they start thinking of how will I do it? Where will I do it? There are some who even are consider not making their loved ones feel perhaps guilty, quote unquote, or they feel like they want to do it far away from home. So they will need time to plan, maybe to even get the resources. So duration would be relative. It will really depend on an individual. But we can be able to spot some of these signs from persons by the things that they say or the way they behave, and then be able to jump in and give assistance. Back to you, Doc.
Yeah, thank you, Naomi. Indeed, it's correct. We should be awake to the fact that some people can actually just do it impulsively. Some may take very long, lengthy processes to hide and plan and execute. So we need to be very, very alert so that we don't miss those that have who are planning. I've seen some people have given inputs. Pauline Wanje has said medics can also come up with ways to share their experiences, especially if their work environment is the same. And then we also need to encourage the medics to seek preventive therapy, just as we do with the Well-Man and Well-Woman Clinic. And that for medics, we need to talk about our experiences openly. So thank you so much, Naomi. Thank you all the participants for a very engaging session. It seems to be an area of very keen interest to many people, and we are continuing with the series. We appreciate all of you for taking your time to listen. I believe there will be a mechanism to share this information with you all. We appreciate the KNHU and webinar team for also making this a success. Thank you, our very able panelists, Ms. Naomi Anyango, for a very wonderful presentation, very informative. Thank you so much, and we have come to the end of this webinar. Kwaherini.
Thank you and bye.